Hello everyone, welcome to our channel Love and We. My name is Pooja and in this video we will discuss the top 5 most common skin conditions in infant and young children. Are you tired of dealing with diaper rashes, eczema, cradle cap, heat rashes and jaundice? Look no further. In this video we will discuss the causes, symptoms and treatment options for each condition as well as tips on how to prevent them. Alright, let's get started. One of the most common skin problems in infant is diaper rash. Diaper rash usually affects infant and young children who wear diapers. It is characterized by red, irritated skin in the diaper area and can be caused by various factors. The main leading cause of diaper rash is prolonged exposure to moisture and friction from the diaper. The skin can become irritated and inflamed when it is in contact with urine and feces for long periods. Other factors that can contribute to diaper rashes include sensitive skin, chafing from tight-fitting diapers, yeast or bacterial infections, and allergic to diaper products. Now, the symptoms of diaper rash include redness and irritation in the diaper area, as well as small red bumps or raised scaly patches of skin. The rashes may be itchy and painful, and your baby may be fushy or uncomfortable. In severe cases, the skin may be cracked or bleeding. Treatment for diaper rashes typically involves keeping the affected area clean and dry and using a diaper cream or ointment to protect the skin and provide relief. Some of the popular ingredients in diaper creams include zinc oxide, petroleum, and dimethicone. It's essential to use fragrance-free products, especially if your baby has sensitive skin. In most cases, over-the-counter products can treat diaper rash at home. However, you should consult a doctor if the inflammation does not improve or become severe. Pediatricians specialized in caring for infants and children can provide more specific recommendations for treating your baby's diaper rash. See the doctor if you notice any signs and symptoms of infections. In rare cases, a severe diaper rash can lead to complications such as cellulitis, bacterial skin infections, or impetigo, or contagious skin infections caused by bacteria. Another common skin issue is eczema. Eczema is a chronic skin condition that causes dry, itchy, irritated skin. It is also known as atopic dermatitis and is more common in infants and children, but can also affect adults. The exact cause of eczema is not fully understood, but it is thought to be a combination of genetic and environmental factors. One of the leading causes of eczema is a dysfunction in the skin barrier. The skin barrier is the outer layer of the skin that helps keep moisture in and irritants out. In people with eczema, the skin barrier is not as effective and becomes dry, cracked, and easily irritated. Symptoms of eczema include dry, itchy skin that can be red, scaly, and swollen. The affected area may also develop small raised bumps that can leak fluids and cross over. Symptoms can vary from person to person and can be worse in some areas of the body, such as the face, neck, and inside of the elbows and knees. Treatment for eczema involves managing the dryness and itchiness of the skin. Keeping the skin moisturized is essential for eczema management, and it's important to use gentle and fragrance-free products, avoiding hard soaps and detergents, and minimizing the exposure to triggers such as dust, paint, danders, and certain fabrics can also help eczema. Over-the-counter topical creams such as creams and ointments containing hydrocortisone or ceramides can provide relief for eczema. In severe cases, prescription medications such as topical immunomodulators may be prescribed by doctors. Dermatologists are specialists in the treatment of skin conditions such as eczema. They can provide more specific recommendations for managing your eczema and may also be able to identify any underlying causes or triggers. See a doctor if your eczema is getting worse and if there is any sign and symptoms of infections. If your eczema is not well controlled, it may lead to complications such as skin infections or sleep disturbances. Cradle cap is a common skin condition that affects infants and young children. It is a type of seborrheic dermatitis, which is a condition that causes scaly, yellowish patches on the scalp. The exact cause of the cradle cap is not fully understood, but it is thought to be related to an overproduction of oil in the skin. Symptoms of cradle cap include scaly, yellowish patches on the scalp and thick, crusty or oily scales. The scales may also be red or inflamed and the hair may be matted or tangled. The cradle cap is not itchy or painful and it is not contagious. Treatment for cradle caps typically involves gently removing the scales by brushing the baby's hair with a soft brush or using mild baby shampoo. Baby shampoos containing salicylic acid, sulfur, or coal tar can help to loosen the scales. It's also essential to keep the scalp moisturized by applying a gentle fragrance-free oil or lotion. In most cases, cradle cap is a harmless condition that clears up within a few months. However, if the condition persists or becomes severe, you should consult a pediatrician or a dermatologist. This specialist can provide more specific recommendations for treating your baby's cradle cap and rule out any underlying conditions. Heat rash, also known as Milia, a skin irritation that occurs when sweat ducts become blocked, leading to red bumps or small blister-like lesions on the skin. It is most common in infants and young children but can also affect adults. The leading cause of heat rash is sweating and overheating. When the sweat ducts in the skin become blocked, sweat cannot escape, which leads to the inflammation and irritations. Heat rash is more common in warm and humid environments. Tight clothing, heavy blankets, or high body temperature can trigger it. Symptoms of heat rash include small red bumps or blister-like lesions on the skin, typically on the face, neck, and chest. The affected area may also be itchy and uncomfortable. In severe cases, the rashes may be accompanied by fever or general feeling of unwellness. Treatment for heat rash involves keeping the affected area cool and dry, loosening or removing tight clothing, and keeping the room temperature calm can help. Over-the-counter creams and lotions that contain calamine or hydrocortisone can provide relief for itching. In most cases, the heat rash clears up within a few days. It's not usually necessary to see a doctor for a heat rashes, but still, if the rashes become severe or persistent, or if you notice any signs and symptoms of infections, it's better to consult a pediatrician or dermatologist. Jaundice is characterized by a yellowing of the skin and whites of the eyes caused by an accumulation of bilirubin in the blood. Bilirubin is a yellowish pigment formed when red blood cells break down. The most common cause of jaundice in newborn is an immature liver, which cannot remove bilirubin from the blood as efficiently as a mature liver. Certain blood disorders, infections, or other underlying health conditions can cause jaundice. Symptoms of jaundice in newborns include yellowing of skin and whites of the eyes. The yellowing may start on the face and then spread to the rest of the body. The urine may also be darker in color and the stools may be lighter. In most cases, jaundice does not cause any discomfort or other symptoms. Treatment for jaundice in newborns typically involves light therapy called phototherapy, which helps to break down the bilirubin in the blood. The newborn is placed under special lights or lamps that emit blue or green light. Phototherapy is typically administered in the hospital settings and is usually done for several days until bilirubin levels have decreased. It's essential to see a pediatrician or a pediatric hematologist if your newborn had jaundice. They will evaluate the blood's bilirubin levels and determine if phototherapy is necessary or not. In some cases, additional tests may be needed to identify jaundice's underlying causes and rule out any severe underlying health condition. In rare cases, severe jaundice that is not treated promptly can lead to certain complications such as brain damage, hearing loss, and other serious health issues. Apart from these skin problems, several other skin problems can affect newborns. Some examples include birthmarks. Birthmarks are colored spots or patches on the skin that are present at birth or develop shortly after birth. They can be red, pink, purple, or brown, and it can appear anywhere on the body. Birthmarks are usually benign but sometimes can be associated with underlying health issues. So it's always best to consult a doctor to rule out any severe underlying health conditions. Navy. Navy, commonly known as moles, are benign skin growth that can appear on a newborn's skin at birth or shortly after the birth. They can be flat or raised and vary in color from tan to brown or to black. Navy are usually benign, but it's essential to keep an eye on them and consult a pediatrician if you notice any changes in shape and size or in the color. Milia. Milia are small white hard bumps that can appear on the newborn's face, particularly around the nose and cheeks. They are caused by blocked Weill's gland and are typically harmless. They usually disappear on their own within a few weeks after a birth without the treatments. Stork bites. Stork bites are small flat pink or red spots that can appear on the newborn's forehead, eyelids, nose, or upper lips. They are caused by dilated blood vessels and are usually benign. They typically disappear on their own within a few months or years. Mongolian spots. Mongolian spots are blue or gray birthmarks that can appear on the lower back or buttocks of the infants of certain ethnicities, particularly those of African, Asian, or Hispanic. They are benign and usually disappear on their own by the time the child reaches adolescence. It is always best to consult a pediatrician if you have any concerns about your newborns. While these skin problems can be uncomfortable for your baby, they are not generally severe and can be easily managed with proper care. If you have any concerns, always better to consult with your pediatrician. We hope this video was helpful and informative, and as a parent, it is essential to be aware of these common skin problems in your baby and take the necessary steps to provide your baby with the best care possible. Thank you for watching Love and We, and see you in the next video soon.